Hi, we are back with Esther's arms. There's been a lot of interest in Esther's arms. It is a problem that I think we hit about 50 and it really affects everybody. I remember when I was in my 40s and all the ladies were moaning about their arms and mine were fine. And then one day I turned 50 and it affected me as well. So yes, now everybody ages differently and we have lots of different products, and some products are better for one problem than compared to another. So we have to pick a product according to the problem that the patient presents with. So when I've looked at Esther's arms, what I'm seeing is more sort of irregularities under the surface. You often have to get your arm in a certain position just to see that irregularity. So other people might present with just the skin looking a bit sort of dehydrated and slightly loose. And other people, very slim people, might have really crepey skin. So depending on what I see will be what I will recommend. Morpheus 8 is great for everybody. So that's great to get the Morpheus 8 going and having 3 sessions of that. But combining it with some injectables to add in some hydration and improving the quality of the skin at the same time can be really helpful. In all the things that we do, combined treatments always have the best results. So we are going to be adding in our injectables with Esther's arms now. The selection of treatments that we have, Profhilo is probably one of the most popular treatments that we do. Lots of people love this on their face and their neck. It's really good for when you just start getting some textural concerns on the neck. It really hydrates the skin. Pure hyaluronic acid. It does stimulate collagen and elastin and really hydrates the skin. So that's a lovely treatment. With this one, we'll do 2 treatments a month apart, and then you'll be on a rolling plan, which can be every 3 to 6 months, depending on the quality of your skin. We have 2 ml syringes for the face or the neck, but on the body we have 3 ml syringes. It's exactly the same product, but just slightly more of it. Then we have Sunekos Cell, which is quite similar to your Profhilo. Lots of hyaluronic acid. There's more product in the syringe here, so sometimes I do, if I think I have a more problematic patient, I might go for the Sunekos. We can have either pure Sunekos or we can have Sunekos Cell. Now, Sunekos Cell is for cellulite. And with Esther, it's not so much the texture of the skin, but that irregularity under the surface, which is due to some sort of fatty irregularities of cellulite creeping in there. So in Esther's case, I am going to go for the Sunekos Cell to treat her arms. With this one, you might do 3 to 4 treatments at 3 to 4 weekly intervals. Depending on the severity of someone's concerns, again, will determine our treatment plan. So it's personalised for everybody. Another option that is fantastic in lots of areas, actually, great in the arms, really great for very poor quality skin in the neck, is mesotherapy. Now, mesotherapy is a cocktail of lots of different things. So we've got, very similar to your Profhilo and your Sunekos, lots of hyaluronic acid, but also polynucleotides, which has come out more recently in the last couple of years. Polynucleotides came out of regenerative medicine in hospital, where they were trying to get rapid healing, rapid improvement of things like leg ulcers and skin burns, and they added in polynucleotides and got rapid skin health and improvement. So that was extrapolated into the aesthetic industry, and we now use it for rejuvenating. So with our mesotherapy, we have a cocktail of polynucleotides, hyaluronic acid. In this one, we've got some niacinamide, which is fantastic for the skin, and a selection of other vitamins in this. Now, I will choose this one if someone's skin quality is really poor. And we really need to boost their collagen, their elastin, and improve their quality of skin. With this one, you'll always do a course of 4 at monthly intervals, and then with all of them, you will maintain your treatment at 3 to 6 monthly intervals, depending on where people's starting point is. So we are now going to go with our Sunekos Cell for Esther, and going to use a cannula and just infiltrate the product under the surface of the skin.